And several countries across the globe are battling a new strain of the novel coronavirus, with governments being forced to impose local curfews, alcohol bans, and in some cases, complete lockdowns. Here in Kenya, the latest statistics from the Ministry of Health indicate, well, things may not be that bad. However, questions continue to arise on whether, as a country, have we battled the pandemic to its end? Let's get more from our very own Kagwe.
Contrary to projections that the month of January could witness a sharp spike in the number of infections owing to the easing of restrictions by the president in November, the December holidays and the resumption of schools, January continues to record low numbers in terms of infections. Between the period of 7th to 13th January, Kenya recorded only 1,157 cases, with an average positivity rate of 3.6%. The week after will see a drop in the number of cases recorded at 889, with the positivity rate being 2.8%. And with the last 24 hours recording only 130 cases, increasing the number of infections to 100,323. This week has also seen the positivity rate stay within the same range at 2.7%, a pattern which to some scientists speaks volumes about the state of COVID-19 in the country.
Our numbers are the best they have ever been. We have definitely flattened the curve. You look at the figures, we have had the best run of 5 to 6 weeks that we have ever had since before the first wave.
However, some experts hold a different opinion.
One is our testing rate. If we normalize the testing rates by population, are we up to the challenge?
According to National Dero, a systems modeling expert, Kenya should be testing at maximum for a true picture of the state of COVID-19 in the country to be seen. Not more than 7,800 people have been tested in one day during the month of January. According to Dr. Ahmed Kalebi, testing in the country is driven by a need basis on whether one has symptoms or not, and is not on targeted populations as in other countries.
It doesn't matter. If you test 5,000 people and you find only 3% of the 5,000 are positive, and you also find that when you test 3,000, it is still 3% or 2-point-something%, versus even if you tested 10,000, it will still be more or less the same. So the actual testing does not affect positivity rate, and that's why I personally think the positivity rate is the best indicator.
The World Health Organization outlines that if a country is to flatten the COVID-19 curve, then it should strive to ensure that there is a decline in number of cases by 50% over 3 weeks, record less than 5% positivity rate over 2 weeks, as well as record a decline in the number of deaths, hospitalizations and ICU admissions. Over the last 3 weeks, Kenya has recorded a steady number, with only a slight decline in the number of deaths, hospitalizations and ICU admissions, from 215 ICU admissions to 192, 4,561 hospital admissions to 3,832, and from 26 deaths in week 1 to 15 deaths in week 3. With the general perception being that the virus could have run its course, scientists are crossing fingers that the new variant experienced in the UK and South Africa will not be recorded here in Kenya. But until then, Kenyans are expected to adhere to all health protocols to ensure that no further stringent measures are imposed. Even so, the country is preparing to receive the first batch of the COVID-19 vaccine in late February.
And when you look at the facilities that we have at JKIA, we're able to store almost 100 million doses of vaccines. Now, that is a lot. It's enough for Kenya. It also takes care of the region as a whole. And why that is very important for us as a country is that the transportation of the COVID vaccine requires cold storage facility of between 2 degrees to 8 degrees Celsius.
The Jomo Kenyatta International Airport is among 6 airports in the African continent that have the best cold storage facilities. The vaccine is expected to be ferried to other countries on a need-to-need basis from the JKIA cold storage rooms by the Astral Aviation Company. Raquel Muigai, Citizen TV.
And still on Raquel's story, a COVID-19 antibody survey conducted in Nairobi between the 2nd and 23rd of November last year revealed that at least 1 in 3 persons here in the nation's capital had been infected with the COVID-19 virus in the 8 months from March when the first case was detected. Half of all households here in the capital had at least one person who had been infected.